Good morning, future medical professionals. Today, I am discussing an essential clinical topic, dyspnea, a symptom of critical importance in detecting and managing cardiovascular diseases. Dyspnea, simply put, is the conscious awareness of breathing, a sensation we typically don't experience unless under severe exertion or stress. When it becomes a symptom, it often points to underlying pathology, particularly of cardiac or respiratory origin. While these systems can overlap due to shared risk factors like smoking, our focus today is on dyspnea as a cardiovascular symptom. Dyspnea can manifest in different forms depending on its triggers and underlying causes. Let's begin with dyspnea on exertion, which is typically a physiological response during strenuous activity. However, it becomes pathological when it occurs during exertion levels that are below what is normal for a patient's age or fitness level. In cardiovascular terms, exertional dyspnea is a hallmark symptom of left heart failure, signifying an increased workload on the heart. Common conditions causing this include systemic hypertension, especially in its accelerated or malignant forms, valvular heart diseases like mitral or aortic stenosis and regurgitation, and cardiomyopathies such as dilated, hypertrophic, or restrictive types. It can also result from myocardial diseases like acute myocardial infarction or myocarditis, as well as arrhythmias, particularly atrial fibrillation. Recognizing exertional dyspnea is crucial for early diagnosis and timely management of these conditions. Another significant presentation is orthopnea, which refers to dyspnea that occurs when a patient is lying flat. Patients with orthopnea often use extra pillows to sleep in a propped-up position or may even prefer sleeping upright in a chair to alleviate their symptoms. This form of dyspnea, though not necessarily linked to exertion, indicates advanced heart disease. It often coexists with paroxysmal nocturnal dyspnea, PND, another troubling symptom that reflects progressive cardiac dysfunction. Paroxysmal nocturnal dyspnea, or PND, involves sudden episodes of breathlessness, typically occurring at night, which awaken the patient. These episodes are highly distressing, often leading patients to sit upright, dangle their legs off the bed, or open windows in search of relief. PND is commonly associated with symptoms like coughing, wheezing, and the production of frothy, blood-streaked sputum. Its underlying mechanisms include increased venous return during the recumbent position, fluid shifts between compartments, reduced adrenergic drive during sleep, and diminished vital capacity during REM sleep. PND serves as a red flag, signaling significant cardiac decompensation. Lastly, dyspnea at rest represents an advanced stage of cardiac dyspnea and typically occurs in patients with severe heart failure. This form of dyspnea, often preceded by worsening exertional dyspnea, orthopnea, and PND, is frequently accompanied by peripheral signs like ankle edema. Its presence demands immediate medical attention, as it often signifies an acute emergency requiring prompt intervention. Understanding and identifying the nuances of dyspnea allow us to pinpoint the underlying cardiac conditions early. Evaluating the grading of dyspnea, associated symptoms, and clinical findings guides us toward accurate diagnosis and effective treatment. Whether it's a patient struggling to breathe during exertion, unable to sleep due to orthopnea, or waking up gasping for air with PND, these symptoms provide vital clues about the patient's cardiovascular health. As future clinicians, you must stay vigilant. Our role is to listen carefully, investigate thoroughly, and act decisively. Every breath matters to our patients and the lives they aspire to live. Thank you, and let us continue to learn, grow, and serve with compassion and expertise.